Okay, guys, for discussion C, we're going to take a look at a holistic approach to geriatric care in a holistic way. So here we go. Prioritizing the 5 M's in geriatric care is all about recognizing that older adults often live with complex and interwoven health challenges, and meeting those needs requires more than checking vitals and adjusting prescriptions. The editorial from American Family Physician outlines how the 5M's framework offers a cohesive, person centered roadmap for clinicians to deliver thoughtfully effective and humane care. Here's how it breaks down. Okay. What are the 5 M's? M, focus. Mind mentation addresses cognitive and emotional health, dementia, delirium, and depression. Mobility focuses on gait, balance, and fall prevention to preserve independence. Medications tackles polypharmacy and promotes safe, effective prescribing. Multi-complexity embraces multiple chronic conditions and their biopsychological impacts. What matters most? Centers care around the patient's values, goals, and preferences. Okay, case-informed contexts. The author highlights an 80-year-old patient, a widow, an artist living with chronic conditions, e.g., depression, cognitive impairment, diabetes, who recently experienced a fall. This scenario brings the 5 M's to life. Mind, her grief and fear of falling exacerbates depression and cognitive challenges. Depression in older adults can double the risk of cognitive decline. Mobility. The fall didn't cause injury, but it undermined her confidence in daily movement, affecting emotional and physical health. Medications. Her regimen needs reviewing to avoid drugs that may heighten fall risk or worsen her mental health. multi-complexity. Multiple diseases require nonsense uh, integrated care that aligns with her health, literacy, and social situation. What matters most? She's uh, she's passionate about independence and art. Her care should empower these priorities. Why this framework matters. Instead of soloed condition specific protocols, the 5 M's push clinicians to think holistically. This age friendly approach bridges the gap between medical management and personal meaning, reducing unnecessary interventions, aligning care with the patient's goals, and improving outcomes and cost effectiveness. If you're reimagining caregiving models, this framework ties beautifully into your focus on equity and autonomy. Want to dive into how the 5 M's could be adapted for smart housing or caregiving education strategies? Absolutely. The 5 M's framework isn't just mimicking, it's a powerful lens for transforming geriatric care from fragmented treatment into integrated, person centered support. Let's unpack it. Deeper significance in both clinical and systematic contexts. why why the 3M or why the 5 M's are a game changer. Holistic, whole person focus. Instead of treating conditions in, in isolation, the 5 M's encourage uh, practitioners to consider how cognitive function, mobility, and medications and multi morbidity all intersect, often amplifying risks or outcomes. This layered view, this layered view better mirrors real world aging. Care aligned with identity and purpose. What matters most isn't just a feel good sentiment. It redirects care planning toward goals that enhance autonomy, dignity, and emotional well-being for someone who values independence or creative pursuits. This measures, this M ensures their voice is central in decision making. Reduction of harm through integration. Polypharmacy, fall risks, and treatment overload can spiral in complex pattern or patients by streamlining attention to interconnected M's. Clinicians can minimize unintended consequences and emphasize safer evidence-based interventions. Enhanced communication across teams. When care teams from occupational therapists to nutritionists share the 5M's vocabulary, it fosters interdisciplinary synergy. Everyone understands the priorities and can contribute meaningfully to tailored scalable equity in practice. For reformer like you, the 5M's offer an actionable blueprint for systematic change, embedding them into smart housing tech training, caregivers in frailty aware strategies, or even redesigning uh, electronic health records can elevate marginalized voices and expand culturally responsive care relevance to your work. Given your depth in frailty aware models and memory friendly design, the 5M's can serve as a unifying backbone. Imagine integrating mobility sensors that flag cognitive mobility interactions or caregiver dashboards that spotlight what matters most to drive daily routines. Okay. Would you like to explore how this framework could be embedded into tech enhanced caregiving programs or scaled across adult day services? I'd love to sketch out ideas with you. Absolutely. The 5M's framework isn't just a mnemonic, it's a powerful lens for transforming geriatric care from fragmented treatment into integrated person centered support. Let's unpack its deeper significance in both clinical and systematic contexts. Why why the 5M's are a game changer. Whole whole person focus. Instead of treating conditions in isolation. The 5Ms encourage practitioners to consider how cognitive function, ability, mobility, and medications and multi-morbidity all all impacts, often amplifying risks or outcomes. This layered view better mirrors real world aging care aligned with identity and purpose. What matters most isn't just a feel good sentiment, it redirects care planning toward goals that enhance autonomy, dignity, and emotional well being for someone who values independence or creative pursuits. This M measures their voice in central in decision making, reduction of harm through integration, policy pharmacy, polypharmacy falls and fall risks, and treatment overload can spiral in complex patients by streamlining attention to interconnected M's. Clinicians can minimize uh, unintended consequences and emphasize safer evidence based interventions. Enhance communication across teams. When care teams from occupational therapists to nutritionists share the 5Ms vocabulary, it fosters uh, interdisciplinary synergy. Everyone understands the priorities and can contribute meaningfully to tailored care. Scalable equity in practice. For reformers like you, the 5Ms offer an actionable blueprint for systematic change, embedding them into smart housing tech, training caregivers in frailty aware strategies, or even redesigning electronic health records can elevate um, marginalized voices and expand culturally responsive care. Okay. Relevance to your work, given your depth in frailty aware models and memory friendly design, the 5Ms can serve as a unidentifying backbone. Imagine integrating mobility sensors that flag cognitive mobility interactions or caregiver dashboards that spotlight what matters most to drive daily routines. Would you like to explore how this framework could be embedded into tech-enhanced caregiving programs or scaled across adult day services? I'd love to sketch out ideas with you. Definitely. Examples are where the 5Ms truly come alive. Here is a deeper look into each one, grounded in realistic scenarios that demonstrate how they can shape more compassionate, effective care. Mind mentation. Example, an 82-year-old woman becomes disoriented after hospitalization, showing signs of delirium. Staff initially attribute it to dementia, but a proper cognitive assessment reveals it's medication-induced delirium. Once corrected, her clarity returns. Implications without turning into mind misdiagnosis can spiral, but with awareness, the right support restores dignity and function. Okay. Integration idea. Your memory-friendly housing could include orientation cues, e.g. lighting, signage, and reduce delirium risks. Mobility. Example, a retired carpenter falls in his garden, physically unharmed. He avoids going outside due to fear, leading to muscle weakness and isolation. Implication, addressing mobility isn't just physical rehab, it's restoring confidence and connection. Innovation opportunity, combine dance therapy and sensor triggered alerts to promote movement while reducing risk. Okay. Medications. Example, an older adult is taking 12 medications, including a benzodiazepine for sleep. She starts experiencing falls and cognitive fog. A review trims her list to 8, eliminating high-risk drugs. Implication, thoughtful deprescribing can improve safety, cognition, and engagement in life. System fix, a caregiver app could spotlight interaction risks and offer alternatives to rooted in behavioral therapy or nutrition. Okay, then we've got multi-complexity. Example, a man with heart failure, diabetes, and depression struggles to follow 6 care plans from different providers. Implications, multi-complexity demands care navigation, simplification, and respect for the patient's lifestyle. Creative angle. Build an integrated platform that tailors care plans based on functional priorities and frailty status. What matters most? Example, an older adult diagnosed with Parkinson's wants to continue teaching painting classes. His treatment plan prioritizes fine motor skill therapy over aggressive pharmacological interventions. Implication: when care when when care honors personal values, outcomes aren't just clinical, they're deeply human. Your intersection. Smart housing features could spotlight residents' passions, giving caregivers cues to weave them into daily routines. Want to brainstorm how each of these examples could be transformed into design? Principles or train models for frailty aware caregiving. I have a few ideas ready to sketch out with you. Absolutely. Designing around the 5 M's isn't just about adopting environments, but it's about engineering, dignity, autonomy, and precision into everyday care. Here's how each M can translate into proposal design principles, especially within smart housing, caregiver workflows, or therapeutic spaces. Mind mentation design principles, cognitive orientation aids, clear signage, natural light rhythms, and memory prompts reduce confusion and support recognition. Okay, emotionally calming spaces, use of soothing colors, soundscapes, and tactile materials can reduce aggression. Smart cognitive monitoring, wearable sensors, or voice activated tools, AI tools to detect mental status changes, speech hesitation, aggression patterns, interactive memory stations, personalized photo walls, or digital storytelling hubs that reinforce identity and narrative cohesion. Mobility design principles, barrier-free navigation, wide hallways, non-slip flooring, and zero-step spaces. Entryways enhance safety and confidence. Movement encouragement zones, visual cues, and natural flow that invite gentle embolization, e.g., circular walking paths, designation seating, fall risk prediction, integrated floor sensors or gait analysis that flag instability trends early, therapeutic motion integration, spaces designed for dance, therapy, tai chi, or movement classes tailored to residential functional levels. Medications design principles. Okay. Simplified medication interfaces. Intuitive dispensers or caregiver dashboards that highlight interactions and reminders. Color-coded systems, virtual cues for medication timing, monitoring versus bedtime to aid memory, minimize errors, digital deep prescribing tools, embedded analysis that recommend streamline regimens based on symptom tracking and risk factors. Privacy and contiguous alerts. Smart tech that respects confidentiality while assuring safety, such as alerting caregivers discreetly. Multi-complexity design principles, integrated health dashboards, centralized platforms that harmoniously multiple care plans and surface priority tasks. Modular living spaces, adaptable environments that flex around changing physical cognitive needs, adjustable lighting, convertible beds, social support mapping, community hubs that facilitate connections based on shared conditions or interests. Fractal care plans, dynamic care modeling that shifts based on real-time feedback, patient preferences, and provider input. Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness, take care, folks.